The idea is that right now, the costs that we talked about earlier on in the show really are the costs that is impacting society now. It's number 7 in public health care costs, preterm birth. And yet, if you look at the investment in research and development of ways to prevent these diseases from happening, it's like down in the 100 range. So it's very low. So there's this big disparity between what it's costing us and what we're doing to try and prevent it. And we need to balance that and make sure that we're investing in something that's having a big public health impact, preterm birth and stillbirth, and investing at the same level that's needed to prevent them.
So long term, it makes sense. It's just good economics. So
Right.
and I like that. It also has a really huge heart component to this, because any family who has lost a child in through stillbirth or you know, just before delivery, it's heartbreaking, and it's a universal pain. It does, as you said earlier, it's a global issue.
That's right.
Tell me a story. Tell me a story that has impacted you and why you continue to do this work.
Well, I think I have several stories, and as I've gone around the world with this, I've heard more and more and seen the impact no matter where I go. It's actually quite strikingly similar. Certainly the economics and things like that are different depending on where you go, but the impact on a family is universal. It's a death, it's a huge loss, whether the baby died in the womb or died after preterm labor or is devastated by the effects of being born premature. And there's a wide range of what we see after premature birth. But the devastation that this causes to the family in terms of their ability to feel successful, even just about reproducing, is huge. And in some cultures, it is devastating to the family in terms of just their place in society. So there's not just the loss, which is huge, if they lose the baby, and over half of the babies, the 4 million babies that die every year around the world, are oftentimes preterm. And it's not just the loss, which is huge, but it's also the impact on them long term. It doesn't go away. Families feel the loss of the baby years down the road. So the impact emotionally is huge. So the numbers are big, the impact is big economically, the impact is huge socially and psychologically. It has an impact on us in so many different ways that to me it's surprising we haven't worked on this harder earlier, especially as we began to have more success at actually taking care of preterm infants. So
you mentioned that you had several stories.
Sure.
Do you have one that sticks with you, that wakes you up at night and you think about the fact that that could have been the next Madame Curie, or it could have been the next Albert Einstein that we lost?
I think there's one that resonates every time I go out to a developing country or when I talk to a family here. And that is that the idea that you can have a baby that is either born preterm or stillbirth and just have another one is a myth that seems to pervade a lot of different cultures. The last time I was in India, which was just a couple of months ago, we were actually interviewing some women in a village in which the average income is less than $1 a day. A lot of those women had, by the time they were 30, 12 pregnancies, and over half of them, the baby had died, either in the womb or just after delivery. So the thing that keeps me up at night is the sheer numbers and impact that would have, not just on the woman, but on the family, and the idea that they can expect that a child born would actually make it past their 5th birthday. So there are stories like that. There are stories right in our own backyard where families have a preterm infant or a stillborn infant, and especially with the stillbirth, have gone the full 9 months of pregnancy expecting a normal child, only to deliver a baby that's already dead and never got a chance. the whole time frame of pregnancy, and just to lose the child at the end. So there's a huge impact that I think about every night when I go to sleep. What really bothers me is that while we celebrate those that we keep alive, we forget about what those who are alive are left with to deal with, or those that have died, that if we had a way to prevent it from happening in the first place. Just think about how robust our population would be then.
Okay. Good point. Well, we're going to take a quick break here. And maybe we're not.
Okay.
So one of the things that I wanted to talk about are partners that you have today. We talked a little bit about Bill and Melinda Gates Foundation. And we also talked a little bit about PATH. Do you see any new partnerships coming in the future? Are you looking for more partners in order to sort of grow your group? And I understand you have 20 employees now that work on your team.
So as we've grown, as we've received more investment from both the Bill and Melinda Gates Foundation for projects and from Seattle Children's Hospital, as well as donors, we're getting great benefit from people that are contributing to our cause as just private donors. One of the things this has allowed us to do is to reach out. Even for the conference, we had help from UNICEF, the WHO, the March of Dimes, the U.S. Aid and International Development Organization of the U.S. government, and donations from various corporations and groups in the Seattle area that were very interested in seeing this conference be successful. Those are our partners, and we are continuing to align ourselves with other partners that want to do work in this area, especially as we try and achieve the Millennium Development Goals that the United Nations has spelled out.
We're here today with the public exposure and Dr. Craig Rubens from Children's Hospital in Seattle, Washington, and we're talking about gaps. So, Craig, I'd like to talk with you a little bit about the Millennium Development Goals.
Okay.
And can you tell me how those came about and how you decided to work on those? They started, I know, when the member states of the UN came about in the year 2000. And where are we now, and are we going to make those goals?
Well, there are 8 Millennium Development Goals that the United Nations put out. 2 of those are very relevant to what GAPS is working on. One is decreasing maternal mortality and adverse outcomes by the year 2015, and another is to reduce child mortality under the age of 5. So one of the things that we are working